Hi, I'm Stephanie Moore with Unity Point Health, and I'm here with Dr. Moodley, who focuses on pediatric infectious diseases here at Unity Point Health. And we're going to get right into a topic that's been a hot topic in the news, and that's this, what people are referring to as a polio-like illness hitting dozens of kids in the Midwest and across the country. It has an official name, though.
So we call it acute flaccid myelitis, and the name describes where the inflammation is. So we think that there's inflammation in parts of the spinal cord that help provide function and power to our muscles. And so that's where the myelitis comes in.
What are the symptoms that parents should look out for if they're worried about this?
So it seems that most children who develop this condition, acute flaccid myelitis, begin their illness with a cold-like illness or cold-like symptoms. So low-grade fever, runny nose, cough, nasal congestion, and then in a very small number of them go on to develop very sudden onset of weakness in an arm, leg, sometimes the face, or the muscles involved in swallowing and eating, and it usually happens pretty quickly.
How is this spread?
So we think it's triggered by a virus, and we believe there are several what we call non-polio enteroviruses that can cause this, and most of them are transmitted from person to person through droplets. So it's possible that through coughing or sneezing that someone who's got the infection can pass it to someone else, but we don't know for certain.
What will happen if the child is diagnosed with this? What are some of the symptoms they'll go through?
So, like I mentioned earlier, a child may very suddenly develop weakness of muscles anywhere in the body. Sometimes it affects one side, sometimes both sides. And if that happens, then we encourage parents to bring their children to their pediatrician or to the emergency room. And then we do an evaluation to see if it is this condition, acute flaccid myelitis.
What is the recovery like? Will kids have to learn how to use those muscles again, or how do they get back?
I think there's a wide range of possible recovery. So there are some children who have a more rapid and more complete recovery, whereas others may take much longer and have an incomplete recovery. Right now, we have no good way to predict how much or how quick the recovery will be in any one child.
The CDC is investigating, but that's nothing new. We're just hearing a lot about this CDC investigating this illness.
That's correct. CDC has been investigating this illness for several years, and every year around this time, so August, September, October, is when we tend to see a spike in the number of children with this condition. And so the role that CDC plays is we report the condition to CDC so they can track the number of cases around the country, and we provide samples to CDC for further testing so they can help us identify what virus or what the cause is.
And this isn't a new illness. We've seen it for several years, and you were telling me it kind of spikes every other year.
It seems to be that way. So we reported the first case in Iowa here in 2014, and since then there have been a number of cases every year, and it seems to follow a cycle of every 2 years, but I think it's really too early to tell.
And what would you say to parents, because as a parent myself, you just worry about your kids, getting something like this?
Yeah, I think the first thing to remember is that colds and respiratory infections are common, and acute flaccid paralysis or acute flaccid myelitis is rare. And so the chances that any child with a cold will go on to develop these complications is still very, very rare. And so I don't think you have to worry about that. But if you notice that your child has new unexplained symptoms, especially weakness of an arm or leg or the face or eyes, then that's a reason to be concerned and to take them in.
This is just another push for everyone to be good when we're washing our hands and hygiene.
Yeah, I think that always helps. So good hand washing is one way to prevent the transmission of viruses between people. There's so many viruses out there that we don't have good vaccines for. This is a good time of the year to get a flu shot. It is one of the viruses that we do have a vaccine for. But for this specific illness, we don't have a vaccine yet.
And I know we talked about it at the beginning, but when people hear polio-like, this is not polio, and we have a vaccine for that, and most kids are vaccinated.
That's correct. So this is not the polio virus. All the cases that have been reported to CDC, no cases of polio virus have been reported or detected, and we do not see polio, or it's not endemic in the United States. So this is not polio, but it is polio-like in that the symptoms it produces is much like polio, with weakness of extremities or the face or muscles of swallowing or breathing.
Like we said, this isn't a new disease, newer here in Iowa since 2014, but are we just hearing more about it in the media, and that's maybe why it's been so popular?
Yeah. Well, I do think this year we've seen more cases than last year, for example. I think as of this morning, CDC reported 62 confirmed cases and 127 total cases. That's more than last year when they reported 33 cases. So I think it's getting more attention because we're seeing more of it. But exactly why that is, I don't think we know.
Anything else you'd tell parents?
Again, colds are common. Acute flaccid myelitis is rare, and if you see any of those red flags or warning signs or symptoms, then take them into their doctor.